Welcome back, everyone, to The Deep Dive. You know we love to dig into complex, multifaceted issues, and today is no exception. We're going to be talking about healthcare in India.
Specifically, some of the really critical political dynamics that impact healthcare in India.
Exactly. And this isn't going to be just some broad overview. We're going to really get into the weeds here, taking a deep dive into a few different but interconnected aspects of India's healthcare system.
We've got some fascinating source material to work with. We've pulled together excerpts from podcasts that have really gone deep on topics like malnutrition,
Immunization program,
the challenges of medical waste management in a country as vast and diverse as India,
and the ongoing efforts to achieve the really ambitious goal of universal healthcare access for all Indian citizens.
Yeah, it's a big one, isn't it? And as we go through this, we're going to keep circling back to this overarching theme. Why is bipartisan collaboration so crucial to actually making meaningful progress in these areas?
Because you can have the best healthcare policies in the world, but if they're not implemented effectively, or if they get bogged down in political gridlock, well, then they're not going to make much of a difference in people's lives, right?
Absolutely. And I think India really illustrates this point in a powerful way. So, listeners, get ready to stretch those brain muscles. Let's jump into this deep dive with an area that, frankly, most of us don't think about very often, but it has a huge impact on public health. Let's talk about medical waste management in India.
Yeah, this is really important, isn't it? So one of the first things that jumped out at me in these podcasts is just the sheer scale of the issue. We're talking about India generating an enormous amount of biomedical waste every single day.
Every single day. And remember, this isn't just regular garbage. We're talking about infectious materials, potentially hazardous chemicals, expired pharmaceuticals, stuff that needs to be handled and disposed of very, very carefully.
And right from the get-go, our sources point to a critical problem. A lot of healthcare facilities in India just aren't doing a good enough job separating different kinds of medical waste at the source.
Right there at the point where it's generated. Imagine, infectious waste getting mixed up with general refuse. What could go wrong there? A lot, actually.
And this failure to properly segregate the waste has a ripple effect across the whole system. Our sources highlight how a lot of states in India simply don't have enough specialized facilities to properly treat all this biomedical waste. So you've got all this potentially hazardous stuff not being processed as it should be.
And what does that lead to? Our sources spell out the consequences pretty clearly. Increased risk of infection spreading, potential exposure to toxic substances for healthcare workers and the general public. And then there's the environmental contamination that comes with improper disposal.
And this is something that really stuck with me from these podcasts. They talk about the informal networks in India, the people who scavenge and recycle medical waste, often without any kind of safety equipment or training, putting themselves at huge risk.
And perpetuating that cycle of potential contamination and harm, it's really a stark reminder of the health disparities that persist in many parts of the world, isn't it? So we've got this fundamental challenge of managing medical waste, but then you layer on top of that the complexities of governance in India.
Because responsibility for medical waste management is actually split between the central government and the individual state governments.
Which sounds sensible in principle, local authorities being responsible for their own waste. But as the sources point out, this often leads to a really uneven patchwork of implementation across the country.
So you can have one state with very strict protocols and good enforcement, and right next door, another state where things are much more lax,
making it incredibly difficult to establish any kind of consistent national standard for handling medical waste.
And then, of course, there's the money issue. Because as you can imagine, setting up and maintaining these specialized waste treatment facilities costs a lot of money. And the sources suggest that many state governments, particularly in those less developed regions, just don't have the financial resources to do this effectively.
It's a classic resource allocation problem, isn't it? Competing priorities and never enough funds to go around. So even when there's a political will to improve medical waste management,
the money just might not be there to actually make it happen.
Right. And then you add to this that sometimes there's pushback from the private healthcare sector, when stricter regulations are proposed.
Because they worry about the added cost of compliance.
Exactly. So it becomes this very tricky balancing act for policymakers. How do you ensure public safety and protect the environment
without imposing an undue financial burden on the healthcare industry, especially in a country where healthcare costs are already a major issue for many people?
It's complicated, isn't it? And just to add another layer of complexity to the whole thing, our sources point to A lack of really effective coordination between different government bodies.
You mean like the health ministry, the environment ministry, maybe even the urban development folks, all having a role to play in medical waste management?
Precisely. And the podcasts emphasize that without that clear communication and collaboration between those different ministries, it's very difficult to develop a comprehensive and effective approach.
So what our sources are really saying is that we can have all the fancy technology, the best equipment in the world for medical waste disposal. But if we don't have those fundamental elements in place,
The political will, the funding, the interagency coordination, the buy-in from the private sector.
then all that technology is not going to solve the problem.
Exactly. So let's talk about solutions then. Where do we go from here? Our sources make it clear that achieving real progress in medical waste management requires political unity, first and foremost.
Yeah. Can we all at least agree on a set of consistent nationwide protocols for how we handle this stuff? Because right now, as we've said, it's just all over the map.
And beyond just setting standards, we need to be actively encouraging investment in more of these specialized waste treatment plants, especially in those regions where they're currently lacking. And to your point about the funding issue, this might mean looking at innovative financing models, maybe public-private partnerships.
So you're bringing in expertise from the private sector, but also using public funds to make sure these facilities are accessible, even in those areas where the private sector might not see a profit to be made.
Precisely. And the sources emphasize that it's not just about building these plants, it's about making sure they can operate sustainably in the long term. And that means dedicated, ongoing financial resources, not just a one-time injection of cash.
Okay, so we've got the infrastructure, the funding. What else do our sources highlight as critical for making sure this all actually works?
Enforcement. Pure and simple. You can have the best policies on the books, but if nobody's actually checking to see if people are following them, what's the point?
So stricter monitoring of how facilities are handling their medical waste, and then real penalties for those who are cutting corners or just not taking it seriously enough.
Right, because there have to be consequences for noncompliance, or people will just keep doing what they've always done. And the sources also emphasize that none of this is going to work if you don't have the people on the ground who actually understand what they're supposed to be doing.
Meaning investment in education and training for healthcare workers.
Absolutely. Making sure everyone, from the doctors and nurses to the cleaning staff, understands the importance of proper waste segregation and disposal.
And why it matters not just for the patients in their care, but for the community as a whole, for the environment.
Exactly. It's about fostering a culture of responsible medical waste management at every level of the healthcare system. And this investment in training has a ripple effect, right? Because those healthcare workers then go home to their families and communities and spread that knowledge.
So let's step back for a minute and think about the big picture. What do we stand to gain by getting this right? Our sources lay out some pretty compelling potential benefits, don't they?
They really do. For one, better medical waste management should lead to a reduction in the spread of diseases, which is good for everyone, right?
Yeah.
Improves overall public health.
And then there's the environmental benefits.
Yeah.
Less hazardous waste leaching into the water supply, less air pollution from incinerators.
Absolutely. Protecting those fragile ecosystems.
And then there's the economic angle. The podcasts point out that improving medical waste management could actually create new jobs in those waste management and recycling industries.
Right. It's not just about preventing bad things from happening. It's about creating new opportunities.
Exactly. And on a more sort of global level, doing this well really strengthens India's reputation, doesn't it?
It does. It shows a commitment to sustainable healthcare practices, environmental responsibility, all those things that really matter to international partners and investors.
Shows that India is taking these issues seriously and is willing to put in the effort to do things the right way. Okay, so we've talked extensively about medical waste, but now let's shift gears a bit to a topic that's really at the heart of any healthcare system, the goal of achieving universal healthcare access and coverage.
And this is a topic that's particularly relevant in India, isn't it? A country with a vast population and huge disparities in income and access to resources.
Absolutely. And while India has made some significant progress in expanding healthcare services, particularly in recent years, our sources make it clear that there are still some very significant gaps in the system. Gaps that need to be addressed.
So let's break it down. What are some of the key challenges to achieving universal healthcare in India that our sources identify?
Well, first and foremost, there's a pretty dramatic divide between the quality of healthcare infrastructure in urban areas compared to rural areas. In cities, you might have state-of-the-art hospitals and clinics. But in those more remote rural communities, there's often a severe lack of even basic medical facilities.
And even when there are facilities available, there's the issue of affordability. The sources really underscore how high out-of-pocket healthcare expenses are a major barrier for a huge segment of the Indian population.
Pushing people into poverty or further into poverty just because they get sick.
Exactly. And it's not just about paying for treatment itself. It's about the lost income from not being able to work, the travel expenses to get to a clinic that might be miles away. It all adds up.
And despite government initiatives like Ayushman Bharat, which aims to provide health insurance coverage to those most in need, our sources point out that a lot of people are still falling through the cracks.
Either they don't qualify for the program, or they just don't know about it, or the process for enrolling is too complicated.
And even when people do have insurance, there's not always a guarantee of quality care, is there?
Not necessarily. The sources talk about inconsistencies in the quality of care provided across both public and private healthcare providers, which can lead to very different health outcomes depending on where you live and what kind of access to care you have.
Which undermines that whole principle of universal healthcare, doesn't it? The idea
Yeah.
that everyone should have access to the same standard of care.
Exactly. So we've got these huge challenges on the ground. But then, as with medical waste management, you've got the political and policy dimensions layered on top of that.
Because, just as with the waste management, and responsibility for healthcare in India is split between the central government and the state governments.
And our sources point out that this can lead to a lot of disagreement about how healthcare funds should be allocated.
You know, who gets what, which programs get prioritized, that kind of thing.
Precisely. And without a clear consensus on those core funding issues, it's very difficult to develop and implement a cohesive national healthcare strategy.
Right. So you've got different states pursuing different approaches, experimenting with different models of care delivery, which might be fine in principle, but it also creates this patchwork system that can be very difficult to navigate.
Especially for those who might be moving between states or seeking specialized treatment that's not available in their home region.
And then you've got that ongoing debate, don't you?
The one about the role of the private sector in achieving universal health care.
Yeah, because India has a very large and active private healthcare sector alongside the public system.
Which can be a good thing, right? Because it introduces competition, can drive innovation, provide more choice for patients.
But it also raises questions about equity and access.
Because if you're relying on the private sector to deliver a significant portion of healthcare, how do you ensure that those services are affordable for everyone?
And how do you prevent a two-tiered system from emerging?
Where those who can afford it get high-quality care, and those who can't are left with a less desirable option.
Right. And our sources highlight that this is a very live debate within Indian policy circles. How do you balance the strengths of the public and private sectors to achieve that ultimate goal of universal coverage?
It's a complex issue, for sure. And of course, there's the challenge of actually implementing these policies. Our sources point out that India, like many other countries, struggles with bureaucratic delays, political roadblocks.
The kind of things that slow down progress and can make it really frustrating for those who are advocating for change.
And it's interesting, isn't it? The podcasts touch on this tendency for short-term, politically expedient solutions to sometimes take precedence over those more fundamental, long-term reforms that might be needed.
Because it's easier to score political points with a quick fix that might benefit a certain constituency rather than tackling those deeper systemic issues that might not yield immediate results.
Exactly. It's that tension between short-term political gain and long-term societal benefit. So given all these complexities, what kind of path forward do our sources suggest for achieving universal healthcare in India?
Well, a big emphasis is placed on the need for greater investment in public healthcare infrastructure, particularly in those underserved rural areas.
Building more hospitals and clinics, equipping them with modern technology, making sure they're adequately staffed.
And alongside that investment in infrastructure, the podcasts argue for making those government-sponsored health insurance programs, like Ayushman Bharat, more inclusive and efficient.
So that more people are eligible, the enrollment process is simplified, and the benefits are sufficient to actually make a difference in people's lives.
And our sources also suggest exploring more strategic partnerships with the private sector. Recognizing that the private sector has a lot of expertise and resources that could be brought to bear on this challenge.
But doing so in a way that preserves those core principles of affordability and accessibility.
Right. It can't just be about letting the private sector do whatever it wants. There need to be safeguards in place to ensure that the interests of the most vulnerable are protected.
Absolutely. And the sources also highlight a really critical point that we haven't talked about yet. You can't have universal health care without enough qualified healthcare professionals to actually deliver that care.
So we're talking about investing in training more doctors, nurses, paramedics, and then finding ways to incentivize those healthcare professionals to work in those underserved areas where they're most needed.
Maybe through loan forgiveness programs, housing subsidies, things like that, making it more attractive for those folks to go out and serve those communities.
And it's not just about treating people once they're already sick, is it?
No. The sources emphasize the importance of really robust preventive healthcare measures. Things like immunization programs, public health campaigns to promote healthy lifestyles, widespread early disease detection screenings.
Catching those problems before they become major health crises.
Exactly, because it's always better and more cost-effective to prevent a disease than to treat it later on. And this investment in preventive care, as our sources point out, isn't just good for individual health outcomes.
It's also a much more sustainable approach to healthcare overall, isn't it?
It is. It reduces the burden on the system in the long run by keeping people healthier for longer. Now, before we wrap up, let's talk about why all of this matters. Why should we care about achieving universal healthcare in India?
Because beyond the obvious moral imperative, the idea that everyone deserves access to quality healthcare, regardless of their income or where they live, our sources highlight some really compelling societal and economic benefits that could flow from getting this right.
For starters, a healthier population is a more productive population, right? Fewer people missing work due to illness, higher levels of workforce participation.
Absolutely. And the sources also suggest that universal healthcare could have a significant impact on poverty reduction.
By removing that constant fear of financial ruin due to medical expenses, families are freed up to invest more in their own futures, to contribute more to the economy.
And beyond those immediate benefits, the podcast suggests that having a strong and accessible healthcare system can actually attract more foreign investment.
Makes sense, doesn't it? Because investors want to see a healthy, stable workforce, a reliable healthcare infrastructure. It all contributes to that overall sense of economic confidence.
And then, of course, there's the reputational aspect. Achieving universal healthcare would really solidify India's position as a global leader.
Not just in economic terms, but also in terms of its commitment to social progress, human development.
Showing the world that India is a place that values the well-being of all its citizens.
So, as we come to the end of our deep dive, it's clear that we've covered a lot of ground. We've talked about the very practical challenges of medical waste management.
And then zoomed out to consider the much broader goal of universal healthcare access.
And what's really striking, I think, is how interconnected these issues are. How improving something like waste management can actually contribute to better public health outcomes.
And how those public health outcomes are then directly tied to the success of universal healthcare initiatives.
And throughout our exploration of these topics, there's been one central message that our sources keep coming back to. It's the absolute necessity of bipartisan political collaboration to make any of this happen.
Because you can have the best ideas, the most well-intentioned policies, but if they get bogged down in political infighting, if they lack that broad base of support across the political spectrum, then they're not going to succeed.
And this is a message that resonates far beyond India, isn't it? Because in any democratic society, addressing complex systemic challenges requires putting aside partisan differences and focusing on those shared objectives, those things that benefit everyone.
And as we leave you today, listeners, we want to leave you with a bit of a challenge. We've been talking about healthcare in India, but think about your own community, your own country. What are those healthcare issues, those deeply rooted challenges that might benefit from a more collaborative, less partisan approach?
What are those areas where we could all stand to gain if we focus more on finding common ground and less on scoring political points? Food for thought.
Until next time. Thanks for joining us on The Deep Dive.